My name is Sarah, this is Karina, and this is Samantha, and we will be discussing our research proposal for L-arginine for schizophrenia. We want to conduct research over L-arginine and try to reduce the severity and symptoms of schizophrenia. The problem, it is considered a psychotic disease. The symptoms separate the patient from their friends and family, and there are many different symptoms because there are many different subtypes. What we know so far, according to the British Columbia Schizophrenia Society, there are 5 subtypes of schizophrenia, such as catatonic, paranoid, disorganized, undifferentiated, and residual, each holding their own types of symptoms. The symptoms are categorized into 3 subtypes, positive, negative, and cognitive. Positive is things such as hallucination, delusions, while negative is withdrawing from friends and family, as well as lack of motivation. Cognitive is things such as lack of paying attention and having a hard time focusing. There is no known cause, but it can develop from many factors such as physical factors, genetic, physiological, environmental, things such as stress and drug abuse. If it runs in the family, people are more susceptible to developing and being diagnosed with schizophrenia. Treatments are available, but there is no exact cure. Treatments such as therapy, antipsychotic drugs, and antidepressants are available.
Schizophrenia is extremely important because even though only 1% of the populations do develop schizophrenia, it impacts the whole family and all their friends because they don't want to deal with anybody, as well as their family and friends not wanting to deal with them. About 10% of the people that have schizophrenia have really big downfalls because they're so alone in life that they have to deal with it all by themselves. Our goal is in this study is to reduce the symptoms and frequency in schizophrenia. In order to achieve it, we will conduct a clinical research trial on patients with schizophrenia using dosages of L-arginine drugs between the age groups of 20 and 50-year-olds. Some conditions are excluded, however, and these conditions include asthma, diabetes, high blood pressure, pregnancy, and heart issues. The methods that we'll be doing, they'll be taking the L-arginine drug in 2 doses a day for a period of 8 weeks or 2 months. We will be observing them in person as well as taking MRI scans to check what's going on in their brain to see if their symptoms are fading away or if they're getting better or not.
Since the patients are not completely capable of making their own decisions, we will require consent from the patient as well as a proxy. The proxy will be the person that has spent the most time with the patient. We will make sure to give clear information to the patient and the proxy. Both of them will know everything that will be going on, how much medication they will be getting, and what kind of medication they'll be getting. We'll be giving tests prior to the study, like pregnancy tests, to be sure that any female participants aren't pregnant, and physical tests to be sure to give the correct amount of medication to each patient. We'll also be asking for the proof of diagnosis of schizophrenia from the patient's doctors. Our roles and responsibilities as researchers is to, of course, receive the consent from the patients and proxy. Since there are no minors participating, we will not need parental consent. We will not be basing our selection off of gender, race, or sexual orientation. And if there is any harm done to the patient, we will stop the research. And we were sure to clearly inform the patients of the worst case scenario that will be happening in the research, and we will have compensation if anything were to happen. Since we do have human subjects participating in our research, we will need consent from the Institutional Review Board. This L-arginine in schizophrenia could provide modification to current treatments of schizophrenia, and it will also impact people directly affected from schizophrenia as well as their family and friends to reduce their symptoms and just help them go on in their everyday life routine.